What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we are covering ethical reasons why the X-ray tech himself can refuse to perform the exam. So to give you context, I am a night shift X-ray tech, been doing it for 4 years. So the few times we as a tech can refuse is if the patient is being hostile, if someone can get hurt or is damaging the equipment, we as a tech can deny the patient work. And depending if it's more of they don't like the tech or something involving like that, maybe we'll get another tech to go and do it and give it another shot. But if they're being hostile and aggressive, usually we'll end up calling the nurse, calling the doctor, telling them what's going on, just to get that. And then sometimes when the doctor comes in and talks with the patient, maybe they'll calm down, or they explain it in the way to let them know, hey, we can't help you, or hey, if you're going to be like this, we're going to discharge you. So sometimes you need other people to come in and they can kind of help with the situation or to de-escalate the situation, and maybe you can do it. There's been times where patients, even in pain with broken bones, will give you like a hard time, and you just kind of have to understand where the line is between if someone's like just ultra mental status versus they're just being mean and being aggressive to you. So you kind of have to gauge. Or sometimes patients have like Alzheimer's and they don't know what they're doing, like that. That happens from time to time, especially over the nights. We get a bunch of the how would I word it? The people who are homeless will come into our hospital and they'll get some X-rays done, and sometimes they'll be drunk or on drugs or other various stuff that makes them not be regular state of mind. So especially if you work a night shift, you'll do a little bit more with those kind of patients versus the day shift. I have noticed, since I do work a lot of overtime in both worlds. So other times I've noticed that you might be only able to get 1 or 2 pictures before the patient starts getting aggressive. Then you'll just kind of document, hey, this is all I was able to get, to let the rad know, because at the end of the day, the radiologist doesn't know what's going on. He just sees the picture and doesn't know, oh, why weren't they able to do this, or why weren't they able to, get more images, or why were the images not oblique enough or internal, or stuff like that. So as long as you document what happened and what was going on, usually the radiologist or the doctor will be more understanding. Occasionally, depending on what's going on, you may have to go back to the patient, and maybe by then they gave him medicine or they knocked him out and he's asleep with the medication, or sometimes he gets intubated or whatever, and you could probably proceed later on to acquire the images, all depending on what floor of the hospital they're in or what they have going on. That's some stuff that you will have to do. Other times, if something is very severe and they do need it, sometimes you can have the family members hold them down and they can do it. We try not to hold down patients like that because it goes against our standard. If they don't want it, we can't force anyone to acquire images. But if the family member is willing to hold them down and do that, then it's a little bit different. Or if they're in restraints, then it's a little bit different compared to us forcefully kind of doing it. Because at the end of the day, if they say the magic word, I don't want it, depending on what it is, you can suggest it, you can kind of persuade them, but at the end of the day, if they tell you no and they're within pretty reasonable mental status and of consciousness, then you can't do it. Now sometimes the doctor may come in and try to talk with them, or the nurses or family members, so it'll happen like that. So just keep that in mind. Yeah, it's been your boy Miguel. Hope you find this informative, and see you on the next one.